Hi there, this is Dr. Tansavatdi. So by now you hopefully have reviewed the consent. These two should go in hand. This is this video is regarding your brow lift post-operative instructions. There is a separate pre-operative instruction that is consistent with any surgery I do, so that is in a separate video. In this video, I'm going to go over post-operative instructions that are specific to the brow lift surgery. So typically I will do a brow lift either by itself or in combination with upper eyelid surgery. So it may, if you do have blepharoplasty, the instructions as well, they may sound like they overlap, and that's okay. So the first thing that you want to know is that day one after surgery, you will have a wrap around your head. That's for the endoscopic or pre-tracheal brow lift. If it is a brow lift incision right above the brow itself, that's called a direct brow lift. And for that, I won't have the whole turban. You will have just ointment along the incision, and I'll be seeing you the next day as well as at 1 week. In regards to the traditional brow lift where we have the wrap, the turban, that comes off the next day. So you will have a 1-day post-operative visit. Before you come in, or the day of the surgery, when you go home that night, the only thing we need you to do is to resume certain medications as well as putting cold compresses over the eyes. The eyes will start to swell pretty quickly and the upper eyelids will get swollen. Sometimes the bruising can go down following gravity and come down to the upper eyelids, making it hard for you to open your eyes. That is okay, that's normal. What you'll want to do is you're going to start cold compresses as soon as you get home. And that's taking gauze that the surgical center should send you home with, or if you don't have that, you can get some cold bag of peas, or if you have cold packs, you can use that as well. You don't want to have them directly on your eyes, so you'll want to wrap it with some towel or gauze. You don't want the ice pack if it's cold and frozen right on your eyes. So you're going to use cold compresses. I suggest using a washcloth. That's my preferred. Is you get a baby washcloth or a small hand washcloth, get it wet, put it in the freezer, and then take it out of the freezer, break it up a little bit, and put that over your eyes. That usually feels really nice and comforting, and so you're going to be doing that once every hour for 15 to 20 minutes each time. You can do it more frequently if you want. There's no harm in doing so. You would do it 15 minutes on, 15 minutes off, 15 minutes on, 15 minutes off. Now you do want to sleep, so if you do feel sleepy, that's okay. You would stop doing the compresses. You don't have to do around the clock at night because sleep is important to your healing process as well. So don't do it in the placement for your sleep. So the first night of surgery, when you're ready to go to bed, stop doing the cold compress and resume the first thing in the morning when you wake up. The medications that you're going to resume the first day after surgery is going to be your antibiotic, which should have been prescribed to you at your preoperative appointment. That antibiotic you should have been taking the night prior to surgery, so you're going to resume that antibiotic until it's done, until it's complete. You want to take that with food. The other thing that we would have given you is the vitamins. That's arnica and bromelain, which are important for bruising and swelling. So you want to resume that after surgery. The arnica is to be taken 3 times a day, and the bromelain is 3 times a day. Both of those taken around your food. That will be easier for you to remember. Bromelain should be taken on an empty stomach, while arnica should be dissolved under the tongue. So it doesn't matter whether you take it before or after your meal. If an incision is planned in the hairline, when we take off the turban the next day, or the wrap, I'm going to be cleaning the incisions. You won't need to clean the incisions after I've done them for you. So following that, you won't need to do it if it's in the hairline or right in front of the hairline. You don't need to touch that. Just leave it be. We just want you to put ointment wherever it is where it's visible in this portion of the hairline. So if it's in the front of the hairline here, you'll put ointment there with antibiotic ointment. If it's in the temporal region right back here, you don't need to put ointment. If it's staples here in the scalp area from a endoscopic brow lift, you don't need to put antibiotic ointment there. You just leave it be. You will want to use, if there are sutures above your brow or maybe in the mid-forehead, those are areas where you'll also want to use hydrogen peroxide with water in a 1-to-1 dilution. So you're doing half hydrogen peroxide, half water, and you're going to dip Q-tip in there, and you're going to apply it over the incision to clean the incision, and then follow it with a dry Q-tip, and then follow that with an application of antibiotic using the Q-tip. And that's over any of the incisions above your brow or in the mid-forehead. Those are uncommon. I do that occasionally, but if that is the case that we've done that for you, that's where you'll be cleaning the incisions. Next thing here is you may experience headache and nausea. First night, for sure, you may feel pressure or discomfort. Some people will describe it as if you've got these bolts in your head. I know I sound sometimes, people don't want to hear this, but as much as I can provide you information to prepare you, it will help you after surgery. So if you feel that there's pressure on the sides of your head, like you've got a tension headache, that's normal. Go ahead and take the pain medications as needed. So we will have prescribed you Tylenol. You should be taking that on a scheduled basis. It's every 6 hours, 1 to 2 tablets. So at least take one. If you need a double, you can, and that's every 6 hours. There's also Celebrex. Celebrex will also be scheduled, and it's twice a day. So you'll be taking that after the surgery. That first evening, you'll take the Celebrex that night for the second dose. You would have taken the first dose right before surgery. So you'll continue taking that for the following 7 days after surgery, and then you'll stop. The other medication we may or may not give you is gabapentin. Gabapentin is also for pain as well, and it's in combination. If you do have some effects where this medication might have an effect with another medication you take, I might not prescribe that. So it's really going to be case-on-case basis, but if I prescribe that for you, you will take that one as well in combination with your Celebrex on that dosing. The other medication that we will prescribe is an anti-nausea medication, and that's to be taken as needed. Zofran is what I usually prescribe. If that doesn't work, please call our office so we can change the medication for you. For most patients, that's enough. Most patients don't have any nausea, but if you do and the Zofran does not work, then you can double the dose the first time. And if it still does not work, then of course you'll give our office a call and we can prescribe you a different medication. The reason why we don't give you something called Phenergan right off the bat is because that can make you groggy and sleepy, and we'd rather want you alert and awake. All right, so after those two that I just talked to you about, you'll want to, the next day after the turban comes off, you can wash your face gently with gentle soap. So you can wash your face, but don't, of course, wash over the areas where the staples are or the incisions are. They'll be a little bit painful if you try to touch them. You can shower 2 to 3 days after. I usually say the third day after surgery is when you can first start washing your hair. You'll want to use a light comb so that you don't go over. So a big tooth comb is better if you want to comb your hair. If you want to blow dry your hair, you'll want to use it at either air dry or blow dry on a low setting. So you don't want it to be hot. This will be warm or even like a cool air to dry your hair, because the scalp itself will be numb and you may not feel the sensation if you do turn the heat up on your blow dryer. All right, next thing after this is, besides that, I got to go back a little bit. With washing your hair, you want to use a gentle shampoo. So that, what we usually recommend is Neutrogena shampoo or Johnson & Johnson, something that doesn't have a lot of chemicals. You could also use a salon type shampoo if it's something that is like organic or doesn't have a lot of chemicals and you know what the ingredients are in that shampoo. Swelling can become greater the second or third day after surgery. So the first day when I take off the wrap, it might not be that bad, and then it can swell more and more as the day goes on, and you can see the swelling come down. following gravity into the upper eyelids and then into the lower eyelids. You can have lower eyelid swelling that looks like it's a balloon under your eyes. That's normal. That's just because of where the lymphatics drain, and they will drain down to your lower eyelids, and then there's a pocket here that will stay. And then eventually you'll see it follow down the rest of your face, and people can see that they've got jowls from the swelling. That's how excessive it can be. But by that time, when you have swelling down here and bruising in the lower face, the upper face will have been better, so your swelling in the upper face and bruising will be gone by that point. All right, the other thing that you want to know is you may feel a tight sensation from the swelling as well, particularly in the forehead area. And as it goes down, that will go away. We do remove the sutures and staples typically at about a week. So if you do have staples, those come out at a week. The sutures are typically, if I use them, they're in the front of the hairline, right here. This is for the pretracheal technique. Or if it's in the brow area or in the forehead, those sutures also come out at 1 week. You cannot shower the day that the staples or the sutures are removed, because the incision can be more open, and if you wash your hair, it can pull open those incisions. So we don't want you to wash your hair the day those come out. So you'll skip a day and you'll go to the next day before you can wash your hair again. Parts of the forehead may feel numb. That's normal. As I explained in the consent, that should all come back. It may take a few months. It may take up to a full year before you feel all the way back up to the top of your scalp. The area above your brow will come back the earliest and slowly migrate all the way to the top. As it comes back, you may feel tingling sensation. You may feel occasional shocks, or you may feel an itching sensation, particularly in your scalp, and that's normal. You may feel some lumpiness in the forehead, particularly there may be some contour irregularities right here in the temple area, because I do put a suture deep that causes a little dimpling from lifting that flap. There is no way to put an implant in that area, so that suture is secured to this muscle here, and that suture is dissolvable. It will go away, so the dimpling goes away around 4 to 6 weeks. So be aware that that can happen, and that's a normal process of healing. The implants themselves, if I do an endoscopic brow lift or pretracheal, sometimes I use an implant that's underneath the skin and it's over the bone. That implant takes about 4 to 6 months to dissolve. In the interim, while it's dissolving, you may feel the sort of little spikes from the implant underneath the skin. It's not sharp, but it feels like little pebbles. Those will go away, and it's not visible. It's more that you can feel it when you touch it. So again, that will go away with time, and just be aware of that. The hair, your hairline should not thin, should not fall out, but on rare occasions we can have what's called a traumatic alopecia. So that's where your body has gone under stress from the surgery, and the hair can fall out temporarily around the incision lines. That's short-lived, and the hair will grow back. With hair, if one full hair strand comes out and there's a clump of this hair that comes out, it does take 6 months for the hair follicles to mature from the little tiny hair follicles to where it's gotten back to its full length and where you can feel it and see it. So you do want to be aware of that. If there is a patch of hair loss, that will take about 6 months to grow back. There's usually little pain following a brow lift, but sometimes the pain can be worse at night, or if you're up and moving, and let's say you exercise, you can't exercise for 2 weeks following the surgery. After that, as you resume exercise, you might feel more pressure and discomfort, and that's normal as well. Talking should be minimized after this procedure. You don't want to do a lot of excessive chewing, because the work that's been done is usually in the temples as well, and there's a muscle here that's involved in chewing, that's where the suture that I place to secure the flap. So if you do chew, you'll feel more pressure and pain from that. To avoid an upset stomach, you'll want to take your medications with food. The only exception is the bromelain vitamin supplement that you want to take on an empty stomach. You're going to take your pain medication as prescribed, so that's the Tylenol and the Celebrex, and perhaps the gabapentin. Take it as scheduled, as I've discussed already. You don't want to combine any tramadol, which is a medication that we give as needed for breakthrough pain. Most of my patients don't need it. Maybe take 1 or 2 pills in that first day or so. If you do take that pill, tramadol, you will not combine that with, of course, with any alcohol, because it will make you very groggy, sleepy, and could stop your breathing. Next thing to know about is that you're going to take your antibiotic as prescribed until it's finished. Don't stop it midway. Finish all the pills that are in the bottle. You're going to take the Celebrex and any other medication as prescribed. It says here to also sleep alone for the first 1 to 2 weeks after your procedure in case your bed partner hits you in the face. Of course, that is dependent on how much space you have on your bed. And the first night, of course, it's always nice to have somebody watch you while you're sleeping for any effects that you might have from the anesthesia. So that is important, maybe that first night. But the following nights, if you're afraid that your bed partner might hit you in the face, that's where you might want some space. Contacts can be used after surgery, but you want to wait for about 1 week after your Browlift surgery. If you've had eyelid surgery with your Browlift, then it's going to be dependent on whether you had upper and lower, or if you had just the upper. If it's upper, it's a 7-day time frame. If it's your lower, then it's a 10-day time frame before you can start wearing your contacts back again. You're going to sleep on your back with your head elevated. The bed should be elevated about 30 degrees. That means you should take a wedge pillow is a great one that you can use, or you can use a recliner, or you take 2 pillows and put it at the bottom of your back. So the lumbar and thoracic portion of your back, not the back of your neck, because that just props your head and bends it forward, which is not very comfortable for you while you sleep. You really want your heart to be your head to be higher than your heart, if that makes any sense. So it should be in a reclined position at 30 degrees or so. And you're going to be wanting to do that for at least the first week, because that will help with the swelling, so that helps your healing process so that the swelling goes away. You want to eat soft foods for the first 2 to 3 days, because chewing should be minimized, particularly because the suture where it's placed on the temple area. You can use chapstick or Vaseline if you have dry lips. Swelling around the area I said earlier will get worse for the second or third day after surgery. You can have bruising after surgery. Typically, the amount of bruising in the forehead is minimal. Where the bruising happens is actually around this brow area and the upper eyelids, and then it starts to extend down to the lower eyelids, then down to the jowls. Crusting can happen over the sutures or the staples. Don't clean them yourselves. So if it's on the staples, just leave it be. Let us take care of it. Don't remove the sutures. If you do see after that first week, maybe we missed a suture, it's okay. We don't want you to pull on it. Let us take care of it. You can experience some weakness or dizziness after surgery. That's true of any surgery, and that is usually because you're not drinking enough water. So imagine that you just did a marathon. Your body has undergone some trauma, and you need to hydrate to heal faster. So the more water you can drink, you want to have your urine when you go pee to be a clearer color. It shouldn't be dark yellow. Okay. You may experience some shooting pain or itching during the healing process. You may be up and around the house. We do want you to walk as soon as you can after a surgery like this. Of course, if it's hard to see because there's a lot of swelling in the upper eyelids, then take your time. Of course, we don't want you bumping and falling. So if it's a little hard to see in the upper eyelids, then take your time getting up. Have somebody help you to get up and move around. But we do want you to move around the house as much as you can, not straining or lifting anything heavy, but walking around the house. If you want to take some walks around the neighborhood, feel free to do so too. Go on with a hoodie and then go on at night or something and walk in your neighborhood. The more you can walk, the faster the healing process will be, because it will help allow the swelling to dissipate from the face. After all the stitches have been removed, as well as the staples, if you see along the incision line, they may appear pink, a deep pink, and then there may be some more redness around the incision. That's normal. That will go away, so the redness will eventually fade to where it goes back to your normal skin color. But that can take a few months to even up to a year for those scars to mature and heal properly. You can use Silicone Scar Gel starting 2 weeks after surgery if you want to kind of help with the healing process of the incision so they heal at their best. And we can give you a recommendation for what kind of silicone scar gel to purchase. You can purchase those over the counter, and we can give you the links to where to find that. You should wear clothing that fastens up in the front. You don't want to have anything that pulls over your head, so you want to find something that has buttons in the front or a zipper, so allows you to pull it over your head, so avoids pulling over the head, but actually just more of the ability to put it on without getting it over your head. Of course, you're not going to want to take drink any alcohol while taking the pain medication. I usually say to avoid taking any alcohol, of course, for the first week after surgery. Some people have to have their little midnight cap or their alcohol on the weekends, so that's okay after the first week. But of course, take it slow. We don't want you to just resume taking a ton of alcohol. Avoid bending over or lifting heavy objects for the first 2 weeks. You're going to avoid straining the stool. If you do have constipation, take a laxative as needed. Avoid getting any sun on any of the incisions, because that can lead to poor healing of the incisions as well. The incisions can get dark anytime you get sun on them. And then of course avoid, this is always a fun one to talk about, but avoid having sex for the first 2 weeks after surgery because it is considered activity. No contact sports for first 2 months after surgery. We already said about strenuous activity. Exercise, the strenuous exercise should be limited for the first 2 weeks. You can start resuming after 2 weeks, but start slow and then build back up to your normal routine. You cannot swim after a surgery like this for 4 weeks because the incisions are not at its strongest yet. So if you do swim, that incision can start to pull open. So it's similar to if you get in the pool or shower for a long period of time, your fingers can get really wrinkled and little soft there. That's what can happen to the incisions. Don't drive, of course, while you're taking any sedatives or pain medications. We don't want you to turn your head from side to side if the Browlift was combined with a facelift. So the first week you might need to have somebody drive you to your appointment in order to remove the sutures and the staples. And then of course, don't remove any of the sutures yourself. The things that we'll want you to report to us are any fevers, so fevers above 100.3 degrees Fahrenheit, if you get a rash, if you get any signs of an infection or hives, allergic reactions, you'll want to call us to let us know about those developing. If you develop a lump that does not go away, of course, let us know as well. If you have persistent pain that is not being controlled by the pain medications, that's also something that you want to let us know. And if you have excessive bleeding, and despite you putting some pressure on it, there's still continued bleeding from the area, we do want you to call us. So the ways to contact our office are by calling us at 805-715-4996 for our front office. For our other contact information, you can contact us through Simplast, through the patient app. There is a conversation button, and under there you will have surgical team or the patient care team. Either one is fine to contact us during normal business hours. If this is after hours and it's urgent, the urgent issues would be a fever, excessive pain, excessive swelling that is not being controlled, discomfort that of course is not being controlled, nausea, vomiting, and any signs that this could be an infection. These are, or excessive bleeding, sorry, that's the last one. Those would be ones that you want to call us after hours, either through the phone number at 805-715-4996 or the last 4 digits 4998 for the urgent line. And then, of course, if this is an emergency, that is, you want to call 911 and reach out to an emergency services before calling us to let us know. Thank you for listening to this. I know this has been a long video, but this should prepare you for your surgery and prepare you for any questions you might have. If you do have further questions after reviewing this video, please write them down, and we'd love to be able to answer those questions for you at your preoperative appointment. Thank you for tuning in.